The longing to have a child is so deep. And couples who are not able to conceive, their suffering is one of the worst sufferings that I have ever seen as a doctor. And so when these couples who are carrying this very heavy cross are looking for help, and they are just given a list of the things not to do, it leads to despair, and it even leads to challenging their faith. And I will tell you, in working with infertile couples, the strongest couples in terms of their faith, daily mass goers, they are tempted to do something like in vitro fertilization because of the desperation they feel. What Catholic doctors, myself, Dr. Beiter, and other Catholic doctors are called to do as part of our vocation is to do everything in our power to give people the positive alternative. We have a positive alternative for treating infertility that works, that is comparable in effectiveness to anything else, but completely respects the dignity of marriage.
Could you tell us a little bit about that? This is all news to me.
Sure. Thank you, Father.
This is not my field.
Yeah, and that's good. Yeah. Well, this is Dr. Beiter's referring to the name that's been given to this approach to women's health care that was developed by a brilliant doctor at Pope Paul VI Institute for the Study of Human Reproduction in Omaha, Nebraska, Dr. Thomas Hilgers, many people that have worked with him for the past 30 years after Humanae Vitae, and in response to the call of Humanae Vitae, a small group of Catholic physicians felt called to continue working to develop alternatives to what was becoming mainstream in women's health, namely these procedures that replaced the Marriage Act to create children and artificial contraception, which was used to treat everything. And so these doctors and these scientists, in response to Pope Paul VI's call, developed a way to monitor and evaluate the woman's system to find out the underlying causes of her problems, including things like infertility, and then treat them in a way that restores her health rather than shutting down the cycle or bypassing it or replacing. And so it's beautiful, actually. It fits in beautifully with the movement in our culture towards a more ecological way of living. We now have an approach that restores health and function, which honestly is what other doctors do in other areas.
I bring in a question here of a psychologist. The thought in the world of psychology often has believed that often there are psychological blocks to fertility, that by what you would call the word in official language is hysteria. It doesn't mean the popular meaning of hysteria, but by a histrionic way you may not be able to walk. I was working on a case of a man who could not see every other day. He was blind every other day because of certain fears that he had. If that is the case, it would also seem that something like infertility could very easily relate to attitudes, fears, underlying things, that a person who's working positively toward the possibility of conception is going to become more at peace with the idea. I suspect only women could say this, but it would seem to me, as an old celibate of 77 years, I could imagine women being frightened of becoming pregnant. And although I come from a big family and lots of kids all over the place, there could be a fear that could be there. Is that possible? Seeing things like that?
I mean, that's possible. I mean, that in terms of fertility, the hypothalamus and the pituitary, these are parts of the brain that interact with the ovaries and the woman's menstrual cycle. Definitely a lot we don't know about that, and stress has a lot to do with it as well.
We're going to have another break, and we're not going to have questions from the audience tonight because Dr. Mielnik was able to get here, and because it's a very serious question. I did want to mention we have a vicar, a visitor this evening, Bishop Hyacinth Agebo, missionary of St. Paul, bishop in Nigeria. Welcome this evening, Bishop.
Thank you very much. Thank you.
Now, our break, I mentioned to Dr. Mielnik and Dr. Beiter that I am the layman in this situation. I'm not used to being the layman, but I am the layman in this particular situation. And we were talking about the very interesting phenomena of an infertile mother adopting a child and then suddenly becoming pregnant and having a nice, healthy baby. Mm-hmm. What do you think is behind this?
Well, Father, it's very interesting. We actually see things like that all the time. A couple working with us at the center will begin going through the process of being treated for infertility. They'll reach a point somewhere along the road where they're just fed up, or they get into a fight with the husband and they decide, this month we're done, we're not trying. And that's the month that they conceive. And it's unfortunately this vicious cycle. The process of infertility, of struggling with infertility, is so stressful. And then the stress of that makes the ability to conceive even more difficult. But the connection between the mind and the reproductive system, particularly in the woman's body, is very profound. And so, yeah, there are couples who conceive the cycle after they've stopped all of their treatment, after years of trying.
Isn't that amazing? You know, it's a mysterious reality, and it is very much the work of God. People start fooling around with organizing things about human development, conception, and fool around with things. They are working against the will of God. And this is what people deny with contraception. You know, a great many people don't recognize, at least personally, that contraception is wrong. It's accepted so widely. And the ordinary person may find themselves in a very difficult position. They cannot support, have another child. Right now they have 3, and they can't handle it. And they think the only possible way for them is contraception. Mm-hmm. One of my relatives, they had their 5th child, and he said to me, I'm going to name him after the Pope. because of the so-called rhythm system and things like that.